Hi guys, Dr. Thompson here with Exemplify Health Center. Today I want to talk to you about some exercise you can do at home regarding your hip. All right, so the first thing we want to do is called the psoas stretch. The psoas is a muscle that attaches on your hip in your lower part of the back, and it goes right down in through there. So let's talk about the two different stretches you can do for your psoas. So you're going to place the affected hip on the ground. This is the one that we're going to be stretching. The least or the easiest thing one that you can do is when you place that on the ground and another foot up onto a chair or table. And what you want to do is go ahead and gently lean forward, and then this is the part of that muscle that we're going to stretch. You're going to hold that for 1 minute. Now, one that's a little bit harder to do, but maybe a little bit more effective, is doing this on the ground. So Kelly's going to show how she's going to go into a deep lunge, and you'll see this will be stretching the right psoas muscle. And again, you're going to hold that for 1 minute. All right, so the second stretch that we want you to do is called the pigeon stretch. And the pigeon stretch is going to be stretching out the back of the hip, like the piriformis muscle, for example. And what Kelly's going to do is she's going to put the affected hip up onto a chair or up onto a table, just like this. And what she's going to do is she's going to sink her backside down to stretch, and then she's going to try to lean forward as much as possible. And again, she's going to hold that for 1 minute. All right, so the third exercise we want you to do is called the prone Criss Cross. And basically when we do this, we're going to be rapidly stretching the hip capsule into internal and external rotation. So what Kelly's going to do is she's going to lay face down on the table, or you can do it on the ground. She's going to bring her knees up to 90 degrees, and she's going to be crisscrossing her feet. So you want to do this at a quick pace, and each time you want to try to go just a little bit further to try to get as much internal and external rotation into the actual hip joint. We want you to do this for 1 minute up to 2 minutes. All right, the fourth exercise we want you to do for the hip involves the foam roller along what's known as the iliotibial band or the IT band. So these are when people have a lot of tenderness or pain that travels down the side of the hip. It's really common in people who do a lot of standing or a lot of running or walking. So we're going to go ahead, and Kelly's going to lay on the table. You can do this on the ground. And you're going to place the foam roller under the affected leg, and basically all you're going to do is you're going to roll up and down on the foam roller. Now this can be really painful starting off, so one of the things that you can do is you can use your hands to push up on the body so you're not providing all of your body weight that's going down onto the foam roller and the hip. So you're going to roll up and down, and you're going to feel some knots, some scar tissue, some really tight places. And so just keep going up and down, and we want you to do this for 1 to 2 minutes. And the fifth and final exercise we want you to do for the hip is called monster walks. We're going to show you what that looks like. But basically what you're going to take is an inexpensive piece of TheraBand, and depending on what size it is, you may need to double it up. And Kelly's going to show you what that's going to look like and what that monster walk actually entails. All right, so Kelly has placed the TheraBand just right above the kneecap, and she's going to hold her feet about hip width apart. And what she's going to do is she's going to start walking to the side to the left, and then she's going to walk back and forth to the right. And as you see, she doesn't close her feet all the way. She keeps that continuous tension on that band at all times. How long should you do it? You should do it until it burns, and then do a little bit more. So you want to go to the left and then also make sure that you go to the right. So this is the monster walk.